Hello, Dr. Pelto here. I want to go over a little bit about ganglion cysts and mucoid cysts. This is a question that I get all the time, and you can see some of these pictures in front of me. Here's a cyst on the outside of the ankle. Here's one on the little toe, kind of an example of a cyst. We're going to go and look kind of about the causes of these cysts. Okay, so let's get right into it. What causes a cyst? To keep it really simple, it can either come from a joint, a tendon sheath, or a bone spur, which would be most likely arthritis. So let me give you an example. You can see here these little lines, these are the joints, and most likely this is coming from one of these joints, and it's kind of like a herniation where it can get like an out pouch from the joint and it can fill up with this fluid. This fluid that's in there, it kind of looks viscousy, almost like a gel, like hair gel. And that's the same liquid that's in the joint and in the tendon sheath. It's used as a lubricant. If you get an example right here, this is an example of arthritis. And this arthritis very easily could injure that joint, that area that's covering it, the joint kind of capsule area, and that can get an outpouch and create a cyst. Sometimes when I do an x-ray of a joint, you can see I put a little marker, this metallic marker I put on there to help me find out exactly where it's hurting them. And this is an example on the side of a big toe joint, this little pocket right here. Okay, so those are the causes of a cyst. I want to go now and talk specifically about a type of a cyst, which is a ganglion cyst, but it's called a mucoid cyst. A mucoid cyst is a cyst that's at the joint level of a toe. So you can see here, this is the joint, this is the joint, this is the joint, and this is the joint. They're filled up with the same type of fluid, and here's my little schematic. Do you like my drawing here? It comes right out, forms that little cyst, and we treat this. Now, specifically with these types, they can pop and things like that. They tend to come back a lot like all cysts. But for this type, to treat it, you actually have to do a surgery. You take out a little bit of the bone, or you shave down the cartilage and fuse both sides of the bone so it doesn't fill up again. Okay, so that's a mucoid cyst specifically. What are the diagnostic exams that you do for cysts? Well, you can do an ultrasound. This is an example of an ultrasound. And you see areas of hypoechoic, basically the black area, and that you can see if it's coming from the joint or from the tendon. This is an example of an MRI. I don't do as many MRIs now that I have a ultrasound. And then other times you can just aspirate it, and that just means sticking a needle in there and pulling it out. That's what most people get. I know what you think it's going to hurt, but you put a little numbing in first, and it's not that bad. And this is an example of the gelatinous. It kind of looks like hair gel, doesn't it? And that's what lubricates the joints and the tendon sheaths. Okay, you pull that out. Now you're going to ask me, does it fill back up? Yes, it usually does. But you say, well, why do I need to have it done? How come you don't know what it is? Well, it could be other things. Okay, and those are the things that we see in the office. This isn't a patient I saw recently on the bottom of her foot. I thought it was a cyst. I got the ultrasound. It looked like a cyst. And when I pulled it out, it actually was a hematoma, which is blood. So she had probably stepped on something and there was blood underneath there. It could be a fibroma. A fibroma is something that happens in the plantar, the bottom aspect of the plantar fascia. You could have a plantar fascia fibromatosis. And once again, you can determine that on ultrasound. It could also be a tumor. So here's an example of a tumor, a fatty tumor that developed there. So it's, again, not a cyst, but looks very similar. And it could be gout. Here's an example coming from the joint. This could be a cyst, but specifically this was gouty tophi. So kind of interesting. There's a lot of different things that they can be. What are the treatment options? Okay, this is how I treat it. And I want to give a little example. I've changed my examples a little bit, but we want to make whatever this thing is, a grape into a raisin. Okay, you want to shrink the grape down, make it a raisin. And so that's what happened. That little cyst, that little pocket that you have there, we want it to shrink down and shrivel up. Another example I use is the balloon. What happens with a balloon, with my kids anyway, is they have a balloon that's filled and they empty it, then they fill it up, then they empty it, then they fill it up. And every time they empty it, it's going to start to stick to itself. So the treatments are to pop it, and you can pop it on your own. You can see this book therapy. Basically, you whack the heck out of it. You might try that on your own, but look at the skull. That's what happens when you do it, and I'm just joking. Some people just pop it on their own. You can try to pop it. I don't recommend doing that. That's because I wouldn't have a job. I pop it, but I just use one of these things, which is a needle, and I drain it. And then I use compression. So I'm putting a little link underneath this video. If you want to get 1 inch or 3 inch Coban, once you pop it, you want to put compression on it. Basically, you empty the balloon, put compression on it so it doesn't fill up again. Okay, that's the whole goal. And how long to leave it on? I would say about 2 weeks. You take it off when you shower. And then if it fills back up again, then you drain it again. And then it might fill up again. If you do it 2 or 3 times and it keeps filling up, then you might want to consider removing it. But I'm hoping every time you empty it, it'll stick to itself. Now, we're not taking out the actual sac. Okay, this is the sac. This is the sac that's around the cyst. That stays in there. And it doesn't matter if it stays in there as long as it doesn't fill up, okay? And then there are other types of things. Okay, I used to do cortisone injections. I don't do cortisone much anymore for these. I just drain them now, okay? Occasionally, we need to do surgery. Here's a couple of examples of cyst removals. Once again, that's the sac. I know that's a gross picture, but that's the sac that you remove, Problem is, this is a pathology report that shows cyst. And the problem with this, though, removal is there's a high chance of recurrence. So we would prefer to not remove it if we can. I like to use checklists. This just really helps me out. So if you're going to your doctor, you can even use this checklist and bring it with you. Basically, you want to get an x-ray to start to see if there's any areas, if it's coming from a joint, something else like that. You might want to mark it with a metallic marker like I did. Then you could do a diagnostic ultrasound. That's what I find most beneficial. And if I'm still unsure, then I'll do an MRI. What are the traditional treatments? Well, you want to reduce the inflammation in size. So inflammation can be helped with anti-inflammatories, but that's not going to reduce the size of it. Aspiration is just pulling out the liquid with a needle. And then compression, that's key. You can't just pull it out and leave it. You have to put compression on it for a couple weeks. Okay. And then avoiding irritation. Sometimes shoes can irritate it. And then some of the advanced treatments, we remove them. To do surgery, remove the cyst. Sometimes you have to fuse that bone, like I mentioned before. And then if things still aren't getting better, you can get a second opinion. So that's all about ganglion cyst. I hope this is helpful, and I'd be happy to answer any questions. Put them here underneath this video.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.